Welcome back to this series on Sinlab Podcast, where we've been getting thoroughly educated about what we all need to know about hepatitis. My name is Patsy Mokunga. I'm still here. I'm still your host, having a great time. And I'm having a great time because with me is Dr. Ganiyat Oyeleke, who has been educating us very well on hepatitis. Thank you so much, Ma, for being here with us once again.
Thank you.
On this episode, we're going to be talking about, the testing, diagnosis, and treatments for hepatitis. And we're going to, get started right off the bat by asking when should the average person get tested for hepatitis? Childhood, adulthood. At what point in your life do you think?
Thank you very much for the question. Again, the testing can be done at any time. So if you're at home listening, ask yourself, have I done this test before? If you haven't done it, I think this is a good time to get hepatitis B testing done, get tested for hepatitis C. So those are the ones that we really put emphasis on: hepatitis B screening and hepatitis C screening, which are readily available. So, and I'm sure they will discuss about further where you can get tested and all
Oh,
that. But
yes.
it's important that you test first. If you test first and it's negative, then you can now get the vaccine, like I said.
And
So there are other tests. So the first test is to do the test to check that you are positive or negative. When you do the hepatitis B testing and it is positive, for example, there are some other panels of tests that you need to do.
Okay.
So you do the liver function test, you do the profile for the hepatitis B, then you do what we call the viral load. The viral load is the one that determines the absolute count of the virus that you have. And that is also very important when we're starting treatment. There are other tests, like I mentioned earlier, could be ultrasound, it could be fibroscan and things like that. And we want to see how the liver appears, if there is presence of scarring in the liver. So those are tests that it's required that you do. But if it's negative, the first screening test, then you have to go ahead and get the vaccine done.
Okay. It's good to know that these tests are very well available at SynLab. Any SynLab location, you walk into SynLab. You don't have to, have a special language. Just tell them you want to do a hepatitis panel. We actually have a panel, meaning that we would treat you for everything. You can ask for specific tests, though. You can say, is hepatitis B? Me, I want to do. You can say hepatitis C, but you can tell them, I want to do a hepatitis panel, and they would just go across board and check you for everything that you need to be checked for. See, trust us. We have you covered. So you can walk into any SynLab location and get tested. Okay, so Ma, I wanted to ask, if there are, what kind of tests are used to diagnose hepatitis. We have different diseases, different tests that are done, some blood, some urine,
Yeah.
some. So what are the tests that should be expected to, in the diagnosis of
So
hepatitis?
in diagnosis hepatitis B, for example, the test we do, the first test is to the one we call the surface antigen, the hepatitis B surface antigen. So that's the screening test. That's the one that tells us whether it's positive or negative. That's the first step. For hepatitis C, we do the hepatitis C screening, or it's an antibody test. It's also a blood test, as the surface antigen test is also a blood test.
Okay.
If those ones are positive, then you go next to do other things. For hepatitis B, for example, we now do the hepatitis B panel. The panel consists of 6 parameters: the surface antigen, surface antibody. I don't want to bore you guys, but there are things that we need to know. But if you tell them, if you go to the lab, for example, and you just say you want to do the hepatitis B panel. So there's surface antigen for B, for surface antibody. There's a core antibody. There's a envelope antigen, envelope antibody. Then you can do the viral load. The hepatitis B, it's a DNA virus. So it's the viral load. That's the more advanced one for people that we do if we need to start treatment. Then for C, we can do the hepatitis C screening as well. If it's positive, then you do the hepatitis C viral load. That will give the absolute count of the hepatitis. In addition, there are some other blood tests, like she mentioned earlier, that's available. The liver function test.
Yes, I was going to ask what kind
yes.
of tests when it comes to like monitoring the health of the liver.
So the liver function test consists of different parameters. There's a bilirubin, which is the substance that colors the eyes with yellow. Then we have the protein and albumin. Liver produces albumin, which is a type of protein produced by the liver. So once there's any issue with the liver, we want to check that the albumin production is adequate and sufficient. And so we do the total protein, we do the albumin test. Then we now check the enzymes. There are 4 enzymes: the aspartate transaminase, alanine transaminase, the gamma glutamate transferase, and alkaline phosphatase. Sorry to bore you guys, but these are liver enzymes that we need to do. So aka AST, ALT, ALP. I'm sure some are familiar with this, but
sure
they are important tests that we have to do. They are available. They are readily available. They're blood tests. We don't need to break the bank to get them. Yes, the viral load may be a bit expensive, but I'm sure when you approach SynLab, maybe there are different packages available.
You can't put a price on your health.
So so those are different tests that one can do to check to see the condition of the liver. And when we get the results, then it will now determine at what time we start treatments, which we're going to discuss in another episode, maybe.
Okay, so I think the next thing I want to find out, you touched on this earlier, but we've talked about the different kinds of hepatitis that exist. So I want to know, are any of them curable, manageable, or is it a for life, disease that you have to live with?
Yeah, thank you very much. It's important to note that the hepatitis that are transmitted through what we eat and drink and contaminants, for example, A and E, those ones do not require any long-term treatments. In fact, they resolve on their own. So the ones that we've put emphasis on are the ones that we know can cause
B and C,
the chronic disease of the liver, B and C, and D. Exactly. So, and I mentioned that D, you only get D if you have B.
Yes, I remember
C
that.
you can have C
standalone.
Standalone, yes. So we have treatments available for hepatitis B, but we do not have a cure up until today. Till now. Up till today, we do not have a cure for hepatitis B, but we have medications that we can use to control it. I recall saying that we can use the viral load to test.
Yes.
So once we start to treat, if you start at a higher viral load, then
it
will be coming down as you start treatments. But you still will not have to stop the treatment. You have to still continue to treatment because it's not curable.
But C is curable.
C, on the other hand, is now curable. It used to be the one that was the very bad one, but right now we have cure for hepatitis C. And it's available. All the treatment is available in Nigeria. The cure is available in Nigeria.
How about D?
D, we only have D when you have B.
Okay, true.
So exactly. So it's also with B.
So that
means it can be managed. It's not curable, but we can manage it.
I'm learning now that C is...
However, D is not very common. It's very, very rare.
Very, very.
The one that is common that we should put emphasis on is majorly B in Nigeria.
I didn't know. Prior to now, I thought all forms of hepatitis were incurable. I actually thought that.
Hepatitis C is now curable. So we have medication available that cures hepatitis C, preventing damage. However, you still have to keep monitoring.
So what are the treatment options? When we said that hepatitis B can be managed, what does that management look like?
Okay. I just wait a minute. There's something just came up to my head as we were talking. So, the other time we're discussing meats, if you recall, we talked about so there's the assumption that people feel because we say is not curable, they will just give up and not do anything. So it's important that people should know that if we say it's not curable, but we can manage it. Diabetes is not curable. Hypertension is not curable, but we use medications that will help us to control. So it's important to know that, because I know that the fear of, a few years ago when we had screening, it was World Hepatitis Day. World Hepatitis Day is 28th July every year. So
Okay.
during the screening, we went to a group. I think they were like maybe it was a taxi station, and I took the group to screen them, and majority, maybe like 4 out of 20 people were positive for hepatitis B that time, and when eventually I went to meet them that we need to follow you up, and they said,
What's the
but
point?
what's the point anyway? It's better that why did you people even come here to test us if you've tested and they said it's not curable? So it's just to let people know that
They
not
feel like it's a
curable
death
means
sentence.
exactly. Not curable doesn't mean that it's a death sentence. Not curable means it's not like malaria that I can give you a drug and say after 2 days it will be fine. It just means that you have to be at it. So we have drugs that are available
And
to
you can
take
live a
care.
very
You
good
live
life
your normal life
with it.
with it. You have to just keep monitoring. So it's important to know that. So over to your question. I forgot.
Yes.
So what was
I
it
was
again?
talking about what like the management or treatment for
Okay.
hepatitis B looks like. You
Okay,
know.
so hepatitis, yeah, so that's also similar to what we're discussing. So for hepatitis B treatments, we use medication, oral tablets.
Oh, okay.
So it is not everybody we treat because we do like those
The
panels
panel.
of tests and the viral load. There's a certain level. I don't want to start stating this in in public discussion so that people will not now say, oh, because my viral load is low, I'm not coming to hospital. So, but there's a certain level where we feel, okay, you don't need to start treatment right now.
It's the
We
doctor
just
that will know, not you,
exactly,
please.
yes, please. So I'm not going to state that now, but it's good for us to know that there's a certain level where we feel, oh, it's a low level, we still keep monitoring. Even when you are not on drugs, you have to be monitored.
Okay, I think an important question for me would be at that low level, what are the chances of transmitting to
At
other
low
people?
level, the risk of transmission is also very low. But you know, we're also discussing with the public that everybody should get tested
Get
and
checked.
get immunized. You
Yes.
understand? So even though the risk of transmission is low, but it's not zero.
It
It's
still
not
exists.
completely absent. So we should note that okay, even when the viral level is low, it may still cause some damage. It's just that it may not be so much. So it's important that you also just keep monitored. I always joke with my clients with hepatitis that is a partnership for life, kind of, at least for now.
You people are together.
Exactly, we're together. So we have to just keep at it. It's not if your level is low, your liver function is fine, and everything is good, you live your life to the fullest. It's just that we have to be careful, no alcohol. We don't want to add on other things that can cause liver damage. Now, there's an entity we call fatty liver.
Yes,
which
I've
means
heard
like
of that.
accumulation of fats in the liver, which could be from alcohol, from weight gain, or rapid weight loss on the other hand too, or high cholesterol or diabetes. So if someone has hepatitis B and also has diabetes, we need to make sure that
everything's all right.
exactly. So in fact, the new indication for treatment now is if you have hepatitis B and you have fatty liver. Let me call it fatty liver. Now, medical time, we're using a different name, metabolic dysfunction associated steatotic liver disease. It's a long name, but AKA fatty liver. Yeah, I know. So if if you have hepatitis and you have diabetes, it may be safer to start treatment for the hepatitis in addition to the diabetes.
Okay.
If you have hepatitis and you have fatty liver, we need to start treatments. So those are indications for treatment. If you have hepatitis, even when your viral load is low, but a sibling, for example, has a complicated hepatitis, maybe has developed, it's best to just start. If you have hepatitis and you already have symptoms of complication, like we mentioned, liver cirrhosis, or if there's swelling in the tummy, which we call ascites, when the water accumulates in the tummy, you have to start. If you have hepatitis and you have yellow eyes, you may have to start treatment. So there are now indications, even when the viral load is low, It's not
other things.
Exactly. We put everyone into perspective before you start
I
treatment.
think what I'm hearing here is like the importance of medical consultation, going to your doctor, actually going to the hospital and
Yes.
seeing that, because this is obviously not a decision you can make by yourself.
Sure.
You simply just don't know enough. You need somebody like a professional like you, Ma, who can look at the entire picture and know that, okay, this is the best thing for us to do at this particular time. So if you're, dealing with hepatitis, I think don't sit at home. Don't even see it as an excuse of I know enough to make this decision by myself, because a lot of us like to self-diagnose, self-medicate, and all of that. But what I'm hearing now is it's still very important to go to your doctor, to go to the hospital, and have somebody walk with you on this journey. I think. So what I want to know now is, like, what are the consequences of late diagnosis or not going to the hospital?
All right. Thank you very much. This is the area that we always wish we won't have to
Deal with.
and deal with, because when you leave hepatitis for too long, we've explained what hepatitis means. So if you recall, we said liver inflammation. Inflammation continues. And when inflammation continues, the cells of the liver are replaced by fibrous tissue. Fibrous tissues are like scar tissues. So that is like the progression of the inflammation. Then there's formation of scar tissue, which is fibrous tissue, which is fibrosis. When the fibrosis advances, it gets to a point we call cirrhosis. Some people may know this. Cirrhosis. Cirrhosis is advanced scarring.
Wow.
That is where we do not want to get to. Because when the cirrhosis gets to that advanced point, it is irreversible.
There's no coming back from it. Wow.
And then there can be formation of development into cancer, liver cancer. So in Nigeria at the moment, hepatitis B is the most common cause of cancer of the liver.
Wow.
So that is where we do not want to get to. The early stages of fibrosis are reversible. And that's the beauty of the liver. The liver can self-repair to an extent. But if the fibrosis becomes advanced, that means the scarring becomes advanced, then it gets to a point where we cannot reverse it. So the essence of all this is whatever we need to pick, we have to pick it early. We have to make sure that we detect all these complications early, and make sure that everything is managed properly before cirrhosis and before cancer develops.
I think that as at this point, we've given ourselves, more than enough reason to go get tested for hepatitis if you do not know your, status as it is now. And if you do know your status, if it is not positive, get the vaccine, because I know a lot of people start the process and stop halfway. Some people stop with the contentment of I don't have it, but
it's not my portion.
Yes,
as we say.
there are vaccines, and if you find out that you have it, we've learned that it's not a life sentence, or it's not a death sentence. You can live a good life. It can be managed. But however, the earlier the better. And if anything, I think this conversation has filled me with a lot of hope when it comes, around this topic, where it's not this scary thing that you just hear and your heart just falls. There's so many ways around it. There's so much to be done and so much that you can do. One of it is to walk into a SynLab location and get tested for hepatitis. We'll be back with the last episode on this series, which has been quite honestly wonderful. While you're waiting, please remember to share this with everybody. We've established that everybody needs this. So share it with everybody. Leave a comment, a comment on your own experience, what you've learned about this podcast, and also follow SynLab Nigeria on all social media platforms. I'll be right back with another episode on hepatitis. Thank you very much for being here.